Hello, my name is Arina Tatiana Viktorovna. I'm an assistant of Department of General Practice Family Medicine. Today's theme of our lesson is cardiac emergencies and cardiopulmonary resuscitation. The main cause of cardiac arrests are cardiac and extracardiac. Primary lesson of cardiac muscle leading to the progressive decline of contractility, conductivity disorders, mechanical factors, and all causes accompanied with hypoxia. Causes of circulatory arrest. It's cardiac. The main cardiac is ischemic heart disease, myocardial infarction, stenocardia, arrhythmias of different origin and character, electricity disorders, valvular diseases, cardiac tamponade, pulmonary artery thromboembolias, rupture aneurysm of aorta, extracardiac, airway obstruction, acute respiratory failure, shock, reflector cardiac arrest, embolism of different origin, drug overdose, electrocardiogram, poisoning. There is a cardiac chain of survival, which has 5 links of the adult out-of-hospital chain of survival. It means recognition of cardiac arrest and activation of the emergency response system, early cardiopulmonary resuscitation with an emphasis of chest compressions, repeat defibrillation, and basic and advanced emergency medical service had post-cardiac arrest care. A strong chain of survival can improve chances of survival and recovery for victims of cardiac arrests. Diagnosis of cardiac arrests is very important, so you doesn't have to lose your time. You don't have to blood pressure measurement, taking the pulse of peripheral arteries, auscultation of cardiac tones. The most important symptoms of cardiac arrest are absence of pulse on carotid arteries, and pathognomic is a pathognomic symptom. A respiratory arrest may be in 30 seconds after cardiac arrest, and pupil dilation may be in 90 seconds after cardiac arrest. Sequences of operation. Make sure the environment is safe for rescuer and victim. Recognition of cardiac arrest. You must check responsiveness, no breathing or only gasping, no difference pulse left with 9 seconds. Then call for help if it's adult victim. If you're alone or with no mobile phone, leave the victim to activate the emergency response system and get the EAD before beginning CPR. Otherwise, send someone and begin CPR immediately. Use the AED as soon as it's available. If it's a children, witness collapse, full of steps for adult and dullness on the left, unwitnessed collapse. Give 2 minutes for CPR, leave the victim to activate the emergency response system and get the AED. Return to the children or infant you rescue CPR. Use the AED as soon as it's available. Then you must correct place the victim and ensure the other airways. Check the presence of spontaneous respiration. Check pulse. Start examining cardiac message and artificial ventilation. If it's adult, 1, 2, or 2 rescuers, 30 to 2. If it's children, 1 rescuer, 30 to 2. And if it's 2 rescuer or more, 15 to 2. Continue compressions at the rate of 100-120 a minute. Give 1 breath every 6 seconds. It's about 10 breaths a minute. In the case of unconsciousness, it is necessary to estimate quickly. First of all, the open airways, then respiration, and then hemodynamics. Main stages of resuscitation. First of all, C. Circulation. Restore the circulation by external cardiac massage. A. Airways. Ensure open airways by preventing the falling back to tongue, tracheal intubation if it possible. B. Breathing. Start artificial ventilation of lung. D. Defibrillation. Drugs and defibrillation. Quickly perform defibrillation diagnosis or cardiac arrest. Use different medical and electric defibrillation in case of ventricular fibrillation. The first aid is circulation. You must restore the circulation, that is, start external cardiac massage. First of all, hand placement. If it's adult victim, 2 hands on the lower half of the sternum. If it's child, 2 hands or 1 hand, optimal for every smaller children, or the lower half on the breastbone, sternum. Infant. If it's 1 rescuer, 2 fingers in the center of the chest, just below the nipple line. If it's 2 rescuer or more, 2 thumbs, including hands in the center of the chest, just below the nipple line. Rate of chest compressions for adult children or infants, it has to be 100 on 120 per minute. Circulation. You must restore the circulation, that is, start external cardiac massage. Depth of compression for an infant is at least 1/3 the depth of the chest, about 1 1/2 inches 4 centimeters. Depth compression for a child is at least 1/3 the depth of the chest, about 2 inches 5 centimeters. Depth of compression for adult is at least 2 inches 5 centimeters. Complete chest recoil is important when performing high-quality CPR to allow the heart to adequately refill between compressions. In the situations of airway, ensure open airways. Open the airways using the head tilt lifting of chin. Do not tilt the head too far back. Check the pulse on the carotid artery using the fingers of the other hand. Then the breathness. Tilt the head back and listen for. If not breathing normally, pinch nose and cover the mouth with yours and blow until you see the chest rise. Give 1 breath every 6 seconds, 10 breaths a minute. There is 2 ways of mouth breathing: mouth to mouth or mouth to nose respiration, or ventilation by face mask and self-inflate back with oxygen. You must do 2 initial subsequent breathing. Wait for the end of expiration. You must do 10-12 breathing per minute with a volume of about 800 milliliters. Each breath should take 1/2 or 2 seconds. Control over the ventilation. Then check chest movement during ventilation and check the air return. Palpation of pulse of carotid arteries, 5-10 seconds. In case of absence of pulse, initiate external cardiac massage. Compression rate is 100-120 a minute. Compression to breathe 30 until 2. Breathing during 1.5 seconds after each 30th compression. 1 breath in 6 seconds. 4 cycles, 30 compressions and 2 breaths. Check the pulse on carotid arteries every 5 seconds, in a long of 5 seconds. In the case of absence of pulse, continue resuscitation. Automated external defibrillation, AED. Repeat defibrillation is important to survival because it eliminates the abnormal heart rhythm. When the AED arrives, the first step is to turn on the AED. After the AED pads are attached to the victim's chest and the AED detects ventricular fibrillation, the next step is to follow the AED prompts. A hairy chest is a consideration when using the AED. The pads may not stick and may fail to deliver a shock. If you need to use an AED on someone who has been buried in the water, put the victim out of the water and wipe the chest before attacking the AED pads. Defibrillation is important because it can restore a regular cardiac rhythm. Ventricular fibrillation or pulseless tachycardia has two steps for help. If it's witnessed, you must do precardial trump, then check pulse. If it's not, begin CPR. Defibrillate with 200 joules. Next, defibrillate with 200 or 300 joules. Establish 4-axis intubate. Adrenaline 1 mg. Push. Defibrillator with 360 joules. Lidocaine 1 mg on milliliter. And then defibrillate with 360 joules. If it unquintises, you must pass precardiac trump and then do the same steps. Possible arrhythmias after cardiac defibrillation. First of all, it's ventricular tachycardia. Bradyarrhythmia including electromechanical dissociation and asystole. Supraventricular arrhythmia accompanied with tachycardia. Supraventricular arrhythmia with normal blood pressure and pulse. Cardiopulmonary resuscitation, or CPR. CPR helps keep patient alive by circulating some oxygen blood to vital organs. Ventilations move oxygen into lungs, where it is picked up by blood. Compressions on sternum increase pressure inside chest, moving some blood to brain or other tissues. CPR continued. Blood circulation resulting from the chest compression not as strong as circulation from heartbeat can help keep brain or other tissues alive until normal heart rhythm restored. Often, electrodic shock from automated external defibrillator AED is needed to restore a heartbeat, and CPR can keep patients valuable until then. CPR effective only for a short time. CPR should be started as soon as possible. In some instances, the heart may start again spontaneously with CPR. CPR in defibrillations with 3 or 5 minutes can save over 50% of cardiac arrest victims. It followed by AED save thousands of lives each year. In most cases, CPR helps keep victim alive until EMC or AED arrives. General techniques of CPR is: in unresponsive, not breathing and no pulse, start chest compressions. Find the correct hand position. 2 hands for adult, or 1 or 2 hands for child, and 2 fingers for infant. General technique of CPR is compress chest hard and fast at rate of 100 compressions a minute. Adult at 5 to 4 centimeters deep. Infant or child in 1/3 or 1/2 chest depth. Release completely between compressions. Alternate 30 chest compressions and 2 ventilations for any age patient. Now let's talk about the mechanism of CPR. First of all, put hands in correct position for chest compression. Give 30 chest compressions at rate of 100 per minute, then give 2 ventilations. Shoulders should be over hands, lock elbows. Keep airway open, watch for chest rise as going on. Then continue CPR until patient begins to move. AED brought to scene and ready to use. Professional help arrives to take over. You are too exhausted to continue. If patient starts moving, check for adequate breathing. If patient is breathing adequately, put patients in recovery position and monitor breathing. When AED arrives, start AED sequence. Chest compressions alert. Be careful with your hands position. For adults or children, keep your fingers off patient's chest. Do not give compressions over bottom tip of breastbone. When compressions, keep elbows straight and hands in constant with patient's chest at all times. Compress chest hard and fast, but let chest recoil completely between compressions. Minimize amounts of the time using given ventilations between sets of compression. It can be problems when CPR technique. CPR often and ineffective because of poor technique. Compressions not delivery steadily and constantly during resuscitation efforts. Often compressions are too shallow, results in an infected blood flow. Compressions may be given at too fast and rate. Only good quality CPR improves chances of survival. Now let's speak about the skills of CPR for adults or children when there is two rescuers. If there is two rescuers, perform it in cycles of 30 to 2 for adult and 15 to 2 for infant or children. One rescuer provides breathing, a second rescuer gives chest compressions. Rescuers with position over every 2 minutes. Change done after full CPR cycle. Accomplish change in every 5 seconds. If AED presents, one rescuer gives CPR while the other sets up until advised CPR. Rescuers give CPR together. Third rescuer can apply uncoiled pressure. If your assistant another trained rescuer who places an advanced air vest, chest compressions give continually. No pauses for ventilations. Give ventilations at rate of 8 to 10 breaths a minute. Transitionally form of one rescuer CPR to two rescuer CPR. Second rescuer moves into position of other side of prepare to take over chest compressions. First rescuer completes a cycle of compressions and ventilation. While first rescuer pauses to check for a pulse, second rescuer finds correct hand position for compression. When first rescuer says no pulse, continue CPR. Second rescuer begins chest compressions and first rescuer then gives only ventilation. There is difference in two rescuers training. If first rescuer responder started CPR, airways second rescuer may have a higher level of training. Rescuer with greater training determines how CPR should best be continued. First of all, rescuer 1 checks ABCs. Rescuer 2 locates site for chest compressions. Then, if no pulse, rescuer 2 gives 30 compressions for adult and 50 for child and rate for 30 compressions a minute. Rescuer 1 gives 2 breaths. Continue cycles for 30 to 2. After 5 cycles, about 2 minutes, switch positions. Adults or child to rescue CPR continued. Continue CPR until patient moves, AED brought to scene and ready to use. Advanced help arrives and takes over. If patient starts breathing and has pulse, put it in a recovery position and monitor ABCs. If AED brought to scene, start AED sequencing. Use different hand position. Place thumbs of both hands on sternum while fingers inside chest. Compress breathstone with both thumbs while squeezing chest with fingers. Same rate and breathe as usual. Now skills for CPR infants for 2 rescues. Rescuer 1 checks ABCs. Rescuer 2 locates site for chest compressions. If no pulse, rescuer 2 gives 15 chest compressions. Rescuer 1 gives 2 breaths. Continue cycles of 15 to 2 for about 2 minutes, then switch roles. Continue CPR until infant moves, advanced help arrives and takes over. If infant starts breathing, hold in recovery position and monitor ABCs. When there is reasons when not to be performed CPR. It's when presence of do not resuscitate order, patient obviously dead. It's in a case of decapitation or a clear sign of prolonged death, such as rigor mortis and department liability. Not safe to be on the scene and the patient cannot be moved somewhere else. A physician pronounces the patient's dead. Drugs used in a CPR, its atropine can be injected bolus maximum 3 mg to blocked vagal tone, which plays significant role in some cases of cardiac arrest. Adrenaline. Large doses have been withheld from the algorithm. Their recommended dose is 1 mg in each 3 or 5 minutes. Vasopressin in some cases for 40 doses can be replaced adrenaline. And amiodarone should be included in algorithm. Lidocaine should be used only in ventricular fibrillation.